Switching topics right now, pregnant women, they get lots of advice from family and friends, even neighbors who are hyper involved. But knowing what's safe and what's not is a big worry. It's a big concern for moms-to-be. Today we bust the pregnancy myths that seem to pick up a lot of traction. Dr. Darren Housel joins me from the Circle of Life Women's Clinic. There are a lot of myths floating around out there. Doctor, how do you recommend to your patients that they decipher what's true and what's false?
Well, talk to your doctor.
Sure.
And then there's lots of literature too. Everybody Googles everything these days, which you will get a lot of mixed information. So yeah, talk to your doctor, get down to the basics.
Let's not
he or she should know.
Let's not let Google be the first source, though.
Right.
All right, let's jump into some of the 5 most common ones that are out there. First, you hear a lot that coloring your hair is harmful. In fact, there are a couple of celebrities that come to mind who have even gone without coloring their hair during their pregnancy.
Not true. Myth-busted. Yeah, I think back in the day, a lot of ammonia was used in hair products. I mean, your scalp's going to absorb a little bit of stuff, but it's not going to be harmful at all to your baby.
So even bleach?
Even bleach. What I hear from hair care people is that when you're pregnant, your hair may not be quite as like it usually is. So you may not take the color like it does or whatever.
Okay.
It shouldn't fall out, but you know.
But not going to harm baby?
Not going to harm baby. Not an issue. All
right, the next myth that is out there that moms aren't so sure about is this idea that you can't get in a hot tub when you're pregnant.
Well, that is sort of true. A lot of the literature will say you shouldn't get in a tub that is more than 101, 102 degrees.
Okay.
And particularly if you're up to your neck in this hot water, your body has no way of escaping that, or letting that heat escape. So there is some potential harm. So
it's not the chemicals in the water, it's just the temperature.
No, chemicals aren't going to hurt you at the temperature.
Okay, so avoid the hot tub.
Yeah, or hot baths over 101 degrees. 102, 103 is really hot.
Sure.
That's like December hot. Park City, you know, so
yes.
Avoid those, yeah, for sure.
All right, there are a lot of myths about food. This is a big one, though. You can't eat sushi when you're pregnant.
So untrue.
So untrue?
Enjoy your sushi.
Really?
Yeah. There's a couple of fish you can't eat. There's 4 different fish: tilefish, mackerel, swordfish, and shark.
Okay.
It has to do with mercury and mercury content in their tissues. So don't eat those. Don't put those in your sushi. Tuna has a little bit of...
I was going to ask you about tuna.
And even the pediatrics people say you shouldn't feed your children tuna very much. They have some sort of specification on that, but there is some mercury involved in tuna. So.
But tuna's not a huge concern? Or?
Yeah, it's like 10 ounces a week or something that you can eat. And that's the light albacore tuna that comes in the can.
All right.
So.
My sister was worried about that during her pregnancy because sushi that's our lunch date. So I can tell her she was fine.
Yeah, good.
All right, let's move on to this next one. You should eat for 2. And this has been a hotly debated topic in the media lately. The weight gain during pregnancy is a big concern.
Yeah, people do gain weight during pregnancy.
Well, yeah.
A lot.
But how much they gain is a concern.
You're not eating for 2. 300 calories is what you should get.
300 more?
Additional calories than your usual diet, okay? Which I think is about a can of soda pop is about 300 calories.
So you're really
not much.
You're not changing your diet all that
much. Really
much.
not a whole lot, yeah. So.
Do people ask that question a lot? Are they surprised to hear that just 300 calories more is all they're allotted?
Yeah. In fact, there's a lot of dietary misinformation out there.
So the recommended weight gain, just review that for us.
20 to 40 pounds has been tradition forever and ever, and that works depending on where you start when you start your pregnancy. So it is something you're hearing more and more about. It seems doctors are cracking down on it. And if you're significantly, overweight when you start your pregnancy, you don't need to gain anything. So, and there's ways of monitoring baby growth and so forth. And what you're worried about is your baby's growth, your baby's environment. And as long as you're providing adequate nutrition, and if you're bigger, you have a lot of stores already. So you don't have to gain a whole bunch if you're already a bit overweight. So while we're on the topic of diet, 300 more calories is all you're allotted. Any other diet changes or additions or restrictions that you counsel your patients against or for? Besides those 4 fish, I mean, eat a balanced diet. I think we learned food pyramids like in 8th grade. Right. Those really do apply. Back to the basics. Yeah. All right, myth number 5, prevent stretch marks. You can prevent stretch marks with lots and lots of lotion. Please say true. Absolutely wrong. It's false, a stretch mark's a fracture in the deeper tissues of the skin and the dermis. And none of the topical stuff you're going to ever buy, no matter how expensive it is going to help you. It's genetic, has to do with the tensile strength of your collagen, and they're going to stretch and crack, or they're not. Yeah, beautiful description. So nothing you can do to really alleviate that. No, and there's products you can take after you deliver that will take the purpleness out of them. The color. But they're going to be there. Darn it. All right. That's one myth I was kind of holding out for. But anyway, thank you so much. My pleasure. Separating truth from fiction, we will let you know if you want more information about Dr. Housel's private practice. You can go to his website. That website is colwc.com, and we'll link you there from our website as well. We'll be right back.